Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be covering anatomy and physiology. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you'll find plenty of resources. You can sign up for a one-on-one private tutoring session. You can sign up for a next generation NCLEX review session, part 1, part 2. You can also obtain audio lessons. So I've got lots of resources available on my website. Again, that's nexusnursinginstitute.com. Now, without any further ado, let's get started. A and P. Okay, first question. Your patient's diagnosed with an ectopic pregnancy. Where would you expect the embryo to be implanted? Would it be the uterus? Would it be the pelvic bone? Would it be the vagina? Or would it be the fallopian tube? Your patient's diagnosed with an ectopic pregnancy. Where would you expect that embryo to be implanted? Yep. The fallopian tube. So an ectopic pregnancy is basically when that embryo is implanted anywhere outside of the uterus. And most commonly, we find it in the fallopian tube. Ectopic pregnancy is also known as tubal pregnancy. It can also happen like in the cervix or in the abdominal cavity, but usually it happens in the fallopian tube. Next question. Name the primary hormone that is secreted by the thyroid gland. Would it be oxytocin, TSH, which is the thyroid stimulating hormone? Would it be adrenaline, or would it be your T3, T4? Okay, good. Most of you guys got the correct answer. It's your T3 and T4. Those are your thyroid hormones. So the question's asking about the primary hormone secreted by the thyroid gland. And so I can understand how some of you guys would be tempted to choose TSH because it says thyroid stimulating hormone. But let's talk about this. Let's go to the first wrong answer, which only 2 of you guys chose, oxytocin. Oxytocin is secreted by the posterior pituitary gland, not the thyroid gland. Thyroid stimulating hormone, that's secreted by the anterior pituitary gland, not the thyroid gland. And adrenaline, I'm happy only 4 people chose that. That's secreted by what? Your adrenal glands, not the thyroid gland. But your thyroid hormone, your T3 and T4, that is what's secreted by the thyroid gland. Something else that you need to keep in mind, you have to understand why your T3 and your T4 and your TSH go the opposite way, right? When your T3 and T4 is high, your TSH will be low. When your TSH is high, your T3 and T4 will be low. These two right here, let me move my mouse. You see these two? They go in the opposite way. And here's why. You have to understand what's happening. Let's say your thyroid hormone levels are too high. Your T3 and T4 is way too high. Your brain basically tells your body, whoa, we got way too much thyroid hormone. We got too much T3 and T4. Thyroid stimulating hormone is not necessary. Think about the name. Thyroid stimulating hormone. What does it stimulate? More thyroid hormone. If your T3 and T4 is already too high, do we need more? No. So guess what? Your TSH, your thyroid stimulating hormone, is going to be low. Now think of the opposite. If your T3 and T4 is very low, you don't have enough thyroid hormone, doesn't it make sense that your thyroid stimulating hormone would be high? Yes, because your T3 and T4 is low and you need more. So we're going to see that thyroid stimulating hormone increase because why? We need to get more T3, T4, right? So just keep that in mind. And the reason I'm saying this to you, because I see this often with students, you guys get a test question and you get so confused when you see the arrows and you see the T3 is high or T4 T3, T4 is high, TSH low, you don't know what needs to go where. That's why I just gave you the reason of why you'll see them go the opposite way so you can understand what's happening in the body. All right, type in your answer. What is a normal term for contractions that normally move food along the digestive system? What is the name of this occurrence? When contractions normally move food along the GI tract, what is the name for that? I'll even give you guys, should I give you guys a hint? It starts with a P. Thank you for sharing the live. Thank you. Digestion, very good. Most of you guys got it. Peristalsis. All right. So those muscles actually push food along the digestive tract. Very good. Let me see what else you guys had. Oh, most of you guys had the pyloric something. You're thinking about a sphincter, okay? That's not peristalsis. You think of pyloric sphincter, swallowing. Someone said poppy. Okay. Oh. Which nutrient does not provide the body with energy? Which nutrient does not provide the body with energy? Here are your choices: vitamins, carbs, fats, proteins. Very good. Vitamins. We love vitamins. We love nutrients, but it does not provide the body with energy. The first thing the body's going to use is carbs. Those carbs get broken down for energy, and then fat, and then last protein, not vitamins. Very good. All right, type in your answer. Name the location within the lungs that gas exchange takes place. Name the location within the lungs that gas exchange takes place. Avocado? Are you serious? Bronchioles, esophagus, alveoli. Very good. The alveoli, that's where gas exchange takes place. Someone said avocado. All right, which hormone is not produced by the pituitary gland? FSH, which is follicle stimulating hormone. We have PNH, we have LH, we have ADH. Which hormone is not produced by the pituitary gland? Okay, very good. 34 of you guys chose PN. I just made that up. PNH is not even a real thing, okay? But FSH, which is follicle stimulating hormone, LH, which is lactating hormone, ADH, what does ADH stand for? Oh, antidiuretic hormone. All of those are produced by the pituitary gland. Now, oxytocin and antidiuretic hormone, ADH, and oxytocin, those two are secreted by the posterior pituitary gland. And all of the other ones, your, FSH or LH or growth hormone, you name them, all of the others are secreted by the anterior pituitary. You only have two that's secreted by the posterior pituitary. And again, guys, it's going to be your oxytocin and your ADH. So that's easy to remember, because if you can remember ADH and oxytocin posterior, everything else anterior. But you got to know those hormones, because PNH, I just made that up. It doesn't even exist. Someone on the live just said, for real, I've only seen ADH. I've never seen FSH or LH. That's Young Jesus. Young Jesus, you'll see it once you get to maternity. All right. What is the normal pH of blood? 4.7, 6.3, 7.4, or 9.1? Bonus if you can tell me the normal range pH of blood. On the live, go ahead and type in the normal range if you know it. Very good, 7.4. You guys on the live, let me tell you something. You better be careful with your decimals, because where you place that decimal, it makes a big difference. Okay, you're gonna mess around and kill your patient. So the normal range is 7.35 to 7.45. Okay. So if that's the normal range, the only number that falls within that normal range here on the slide would have been 7.4. All right, which portion of the human brain controls balance and coordination? Is it cerebellum, the frontal lobe, the occipital lobe, or the parietal lobe? Which portion of the brain controls balance and coordination? Okay, very good. Cerebellum. So if that portion of the brain is affected, we're going to be most concerned about what? Safety, falls, right? What about the frontal lobe? When it comes to the frontal lobe, we're going to be concerned about that patient's decision making. Occipital lobe, vision, and parietal lobe, sensory, such as touch, taste, smell, things like that. All right, which could be a symptom of a vitamin D deficiency? Vitamin D deficiency. Would it be easy bruising, confusion, crooked bones, or hyperactivity? Very good. Crooked bones. Think about it. What makes your bones nice and strong and straight? Calcium makes your bones nice and strong, right? Well, you could take as much calcium as you want. If you don't have vitamin D to absorb the calcium, it really doesn't do much good, right? So if the patient has a vitamin D deficiency, it's very likely you'll see that patient having bone issues such as crooked bones. Now, easy bruising, many things could cause that, but one of the main things that could cause that would be like if the patient had platelet deficiency, because remember, platelets, live visibility restricted. Guys, can you see this on my live right now? Do you see that thing that just popped up? One second, guys. Yeah, I just got some warning saying that you can still see me okay. It said that my live is not original content. I literally just made these questions up myself. So I know they're original. Okay. I'm sorry, guys. What was I saying now? Yes, easy bruising. So, for example, if a patient's platelet count was low, they can bruise or bleed easily because remember, platelets, that's what helps you to clot. Now, when it comes to confusion, lots of things could cause confusion, such as infection, UTI, especially in the elderly. But something else that can cause confusion would be something like vitamin B12 deficiency, right? And the last choice, hyperactivity, I just threw that in as a symptom. But anyway, when it comes to vitamin D deficiency, you should be thinking of things like crooked bones or maybe even porous bones or osteoporosis or patient being at risk for fractures just because we understand that line of thinking. Decreased vitamin D, decreased absorption of calcium. Calcium is important to the bones. By the way, you also need to know an important source of vitamin D, which is what? Sunlight. All right, what is the name of the bone in the thigh? This is easy. What is the name of that bone in your thigh? Is it the ulna, the radius, the humerus, or the femur? Very good. That thigh bone is known as the femur. The ulna, that's the bone of um no. Which one's the forearm? I can't even think. Your upper arm or your lower arm? I think it's your lower arm. But anyway, that bone that's on the side of your pinky, that is your ulna. And then the other bone on the other side, that's on the side of your thumb, that's your radius. And then your upper arm, that bone is a humerus. But the bone in your thigh is the femur. Forearm. Okay, thank you. I had a brain fart for a second. Okay, histology is the study of what? Blood, cells and tissues, the heart, or symptoms. Histology is the study of blank. Very good, cells and tissue. 6 people chose blood. The study of blood is hematology. 1 person chose the heart. The study of the heart is cardiology. And 6 people chose symptoms. The study of symptom is symptomology, right? But when we're talking about cells and tissues, that is histology. All right, what is a secondary defense for the body against pathogens? Cough, sneeze, flatus, or inflammation? What is a secondary defense for the body against pathogens? Very good. Inflammation, right? What causes that inflammation? Everybody's rushing to that area to help. Blood, which contains oxygen, vitamins, minerals, nutrients, WBCs, everything's rushing to that area to help. Inflammation. We also see swelling. Now, guys, extra points yes, very good. Extra points if you can tell me what the primary defense of the body against pathogens is. Flatus, that's farting, not sneezing. No, mucous membranes, very good. Mucous membranes and what? Skin. There you go. Very good. The skin and mucous membranes, that's your primary defense. That is your primary defense against pathogens, bacteria, viruses, fungus, all that good stuff, right? And then let's say they get through, your secondary defense is inflammation. Very good. Flatus. Okay, the superior and inferior vena cava drains blood from the body into where? Is it the right atrium, the left atrium, the right ventricle, or the left ventricle? By the way, you cannot escape this. You absolutely have to be able to trace blood in the body. Oxygenated and deoxygenated. You can't run away from it. Make sure you can do that. Very good. Right atrium. Okay, the diaphragm separates which two cavities? Is it the pelvic and abdominal, the pelvic and pericardial? Did I spell that wrong? Pericardial or pericardal? Anyways, the cranial and vertebral, or abdominal and thoracic? Very good. The abdominal and thoracic. So here's the thing, guys. Your diaphragm is right between your thoracic um area and your abdominal area, because I can't think of the word that I'm looking for. But anyway, your diaphragm, it sits like this, right? It's like this, right? Right under your lungs. You take a deep breath in and it flops down to make room for air. That's how your lungs expand. It flops down, right? Because now your lungs are full of air, it's full of oxygen, right? And then when you breathe out, it flops back up. Okay, this is the resting position for your diaphragm. You take a deep breath in, it goes down to make room for the air, and then you breathe out, it goes back up. That's why it's so important when a patient's having a condition that they can't breathe, you sit them up. Why? You sitting them up, you're taking pressure off of that diaphragm, because think about it, you have all this abdominal girth, you're taking pressure off the diaphragm, and you want gravity to help that diaphragm go down when that patient takes a deep breath so that the lungs can expand. That's why when the patient's having difficulty breathing, before you give them oxygen, before you take their vitals, what is the first thing you do? You sit them up. You sit them up to take pressure off that diaphragm so the diaphragm can drop and the lungs can expand. I never thought about it that way, and you're never going to forget now. All right, last question. Here's the last question. Which vital signs are within therapeutic range? Would it be a patient with a heart rate of 52, blood pressure 76/61, heart rate of 74, blood pressure 100/72, heart rate of 100, blood pressure 145/120, or heart rate of 120, blood pressure 150/88? You guys absolutely need to know therapeutic range for your vitals. Very good. Heart rate 74, nothing wrong with that. Heart rate's supposed to be between 60 and 100. Blood pressure 100/72, nothing wrong with that. Supposed to be between 90/60 to 129/90. Now, once you hit 130, you're in that pre-hypertension or hypertension stage 1. Once you hit 140 higher, you're higher than 140, you're definitely hypertension 2. So we want to be in the safe range. That's why I chose 100/72. And that is it for A&P, guys. Let me know in the comment section if you'd like to see more Kahoots on A&P. I'd be more than happy to provide them for you. But in the meantime, let's see how you guys did.